Hello, everyone, and thank you, Dr. Adamson, for the kind invitation to present to everyone this evening. I hope you're having all a great night, a little break from some craziness that we've all had to experience in the past year. I wanted to start by introducing to you my little friend and first little patient. His name is Abebe. He's a little 7-year-old boy, and he was the first patient that we saw in Addis Ababa during our mission. And this boy represents the strength, resiliency, the humanity, compassion that we saw in the Ethiopian people, but it also reflects the strength, resiliency, humanity, compassion of Face the Future Foundation, of which I'm a very proud member. This little boy had, as you can see, a lesion behind the eye. It was behind the jaw on the right-hand side, and it was pushing forward all the tissue as well as part of his eye. Now, they arrived late at the consultation clinic, so people had been lining up for about 2 weeks because the Western doctors were coming to treat them, and parents came with their children lined up. But as they saw this little boy with the eye, they kind of bumped him up to the front of the line. And he was an amazing little kid. He would bounce on the table, have us do biopsy. He would see us for the surgery. He didn't flinch. He was very strong. Even though he knew, for example, in rounds afterwards, and we had to remove dressings, and he knew it would hurt, he still was steadfast, like a little soldier, always upright. And it also represents what I wanted to share, is how the many hands and the many people behind treating this boy are represented here this evening. We took part of the sample of biopsy and put it in our pockets and traveled across the borders back to Canada to get a sample of what was. Luckily, it was a benign lymphomangioma. And Dr. Cuddy, my partner who I'll introduce in some of the pictures, did a fantastic job of debulking this young child's tumor and saving his vision. My name is Marco Caminiti, and I am the Program Director at the University of Toronto in Oral Maxillofacial Surgery and a proud member of the board of the Face the Future Foundation. I want to thank many people that were able to make this mission possible, especially all the people here this evening that are participating. This was a collaboration also with the University of Toronto and the University of Addis Ababa, but primarily focused through Dr. Peter Adamson and Face the Future Foundation. Ethiopia is the second most populous country in Africa. It's landlocked at the Horn of Africa. There's over 110 million people, very proud people. They're the only country on the continent that wasn't colonized. It is the home of Lucy, our foremother, and also the origin of the Queen of Sheba, who married King Solomon. Addis Ababa is the capital and the largest city in Ethiopia, and it is a bursting metropolis of 2, 3, 4 million people, difficult to count. On the one hand, it has stark modern facilities, and on the other hand, it has extreme poverty that is unimagined. We worked at the other St. Peter Specialist Hospital in the north end of Addis Ababa. You can see some of my friends roaming around here. And just from this little balcony, I took another picture that gives you a representation of where it was. It was about 10 kilometers from the city, and the city's in this valley at a very high altitude. This is the image of the emergency department and the lineup of people that would form every morning to be seen at the hospital, which was a multi-specialist unit. This is a little picture of the ambulance that they would cram patients in. This isn't for one patient, this is for 4. Inside, the hospital lacked even fundamental applications that we require. We would even have to use water from this barrel that said it was clean, but even this would run out, so we would have to use some denatured alcohol. And there's a picture of Carl, Dr. Cuddy, getting his hands washed prior to surgery, and the stench was pretty bad, so even with double masks it was not easy to handle. Is a view of some of the equipment in the operating room, and I wish I had a picture of the radiator on the side, but it's a Mastercraft from Canadian Tire, also sent from Canadian donations, I'm sure. This was the anesthesia unit. They needed bulb suction because oftentimes suction wouldn't work. This was their cart in the middle, and on the right side was the so-called sterile room in between the ORs where the nurses would prep cases. So this is our first day. This was the lineup of patients that we had seen that were waiting for us to see. And the first one, of course, was Lalibella. But here are a few other patients that we had seen. This young man is a 13-year-old boy whose jaws were completely fused together following a traumatic incident when he was much younger. Without physiotherapy and appropriate post-operative care, these jaws completely fused together, and this is not an uncommon thing in Africa. This is a young boy with hemifacial microsomia where half the face didn't form properly, requiring ventral surgery to help reconstruct and rebuild the jaws in a proper position. We saw minor benign hemangiomas. We saw patients with complicated cases. This is actually a young medical student, first-year medical student. She has cleft palate and a treated cleft lip, but significant maxillary deformity, requiring further orthognathic surgery. This young girl is the same as the other boy. She was 12 years old. Her jaws were completely fused. When she was 3 years old, she fell, broke her condyles of both the joints, which eventually fused. And she eventually was unable to open after many, many years. And this is as far wide as she could open. Another common problem in Ethiopia or in sub-Saharan Africa is the use of kerosene. This is a 21-year-old young lady who suffered a kerosene burn when she was a young teenager, and she was basically cast away from her small town and tribe. And she actually waited for 2 weeks out front of the clinic to be treated and really didn't have a home, so she stayed on the lawn in the evenings and at nighttime waiting to be treated. The kerosene burn scarred her entire jaw in this open position. And she was quite afraid of people, so there are other psychiatric elements that we had to be very sensitive to in treating these patients. Further complication in Ethiopia are hyena bites. We have dog bites, they have hyena bites. This is a 16-year-old girl who had initially treated with a skin flap, but her left side of her face was completely paralyzed. She was unable to close her eyes or move her jaws. Another young lady with hemangioma. This one we were unable to treat. This is easily treated in North America with laser ablation. This was a pharmacist who had a tumor called an ameloblastoma of her jaw, and she had been waiting for years to get some sort of treatment. We were able to see her. And then we saw a number of cleft lip, cleft palate infants that were brought by their mothers to get treated. So I just wanted to show you a couple of slides. I promised Peter I wouldn't show anything gory, so this is about as bad as it gets. But this is the young girl, a 12-year-old. On the right side, on the left panel, you see her with the mouth closed, and this is on the central panel, is with her opening as wide as she can. And this is the image of the drill that we had to use. This is a 1950s contraption where you would spin around to get the drill activating into the bone. So we really had to deal with some challenging situations. But this is her 2 days afterwards. She has a trach, she's in the ICU, and she has little tears there, but the tears aren't of pain, the tears are of joy, as she's the first time that she's been able to open her mouth in 8 years. This is an image of that pharmacist with the ameloblastoma, and in the top panel there is, at the time was the chief resident, Dr. Mike Laschuk, who's now in Windsor, and we found a fancy drill, but we had to cover it with a sterile glove in order for us to use it. This is an image of me having to cut the reconstruction plate, so essentially part of her jaw had to be resected, and we replace it with a metal plate. This metal plate she had to purchase herself. The hospitals don't carry these. The hospital also doesn't carry the instrumentarium that allows us to manipulate these plates. So I had to go across the street to a construction site and grab their pipe grinder but also the pipe grinder didn't fit the plug, so I had to unwire the end of the extension cord and plug it directly into the wall. And finally I found a method to cut this plate. And this is her afterwards, just showing the resection in place, the resection out with the plate in place, and we were able to help this young lady out. And just some images of some of the cleft cases. It's always cute to show these little kids, and the fairly straightforward and easy work it takes to do. Not that cleft lip is easy, but of all the treatments, it's a soft tissue element, so we don't have to deal with a lot of the bone and the other materials that could be a challenge. This image shows a picture of myself with a group of residents. We had the wonderful opportunity to work with and train a very keen and excited group of young men and women. And this picture shows the image of all of us here. This is Dr. Carl Cuddy. This is Dr. Travis Tollefson from University of Southern California. This is David Shea from Harvard. This is Dr. Demirou. He is the program director in Addis Ababa. And then here's Dr. Mike Laschuk, from one of our residents. And this was the group of residents at this course. So it's a nice picture of all of us together, and everyone's smiling because they are happy. I wanted to show this picture of Dr. Demirou, who we became good friends. This is about as big as a smile as you can get from him. Ethiopians are very shy. They're very quiet. Most of the time you have to kind of lean in because their voices were always a very low tone. I was there for 2 weeks. I did not hear anybody raise their voice. Very peaceful people. But he's very happy that Dr. Tollefson said he could take the little Black & Decker drill, which he brought immediately to the OR. We did manage to sneak away for a weekend. We went to a place called Lalibella, which is one of the most fascinating places on the planet. Most of Ethiopia is untouched by tourism. These are churches. There are 12 churches that are dug into the ground. This is not built up. And inside is a church, and there's 12 of them. Here's a Ethiopian Christian Orthodox priest. We also managed to get to one of the open-air market they've estimated is about 2,000 years old, where the southern lowland grain farmers come up to the mid-plains with the animal exchange, and then there's the upper highland farmers that bring everything together, and this happens every single Saturday. So that's the end of my talk. I hope you got some insight into our trip in Africa. This is the young boy that was tugging at my sleeves as we were leaving, promising me to come back, and I promised I would, so I kind of have to now. I'd like to thank Dr. Adamson for his incredible organization and just such an incredible person. I have Dr. Carl Cuddy there in the middle, who is my partner at the university, who's an incredibly talented surgeon. And also on the right panel is the Dean, Dr. Dan Haas, who's the Dean of the Faculty of Dentistry, without which I would not be here. So thank you all very much, and enjoy the rest of the evening.